given once every month or so. We'll kind of see how you react to it and how it responds. If your numbers go up nicely, you may not need it as often. If you don't respond nicely, you may need to do it more often and things. But I'm not going to know the answer for sure for at least a couple days until we get all these tests back. If you
Okay,
needed this shot called Retacrit, then we would start that as soon as next week.
okay,
But I'm betting that's what you're going to need. I'm going to give you this for your records. And what I'm going to do is go ahead and order the Retacrit next week, assuming that's what you need so that we can get it covered by insurance, get you on the schedule. And then if something changes in the meantime, then you need something different, we'll call you.
okay. That have to come back here to do that, or where you do that?
Yes,
stuff?
sir. You do that here in this building.
Okay.
Unless one of the other car ties is closer for you, North Little Rock, Pine Bluff,
Well, this is probably closest.
Stuttgart, any of those,
I'm over to Villas.
Conway. But that's normally something we do here, and it may not be every. We'll start about every 2 weeks to build you up, and then we maybe would be able to space it out as you respond. Some people get it once every couple months, and they do okay with that. But we're gonna build it up some. It's too low.
So, how do you connect all this with the wound clinic and all that? Is this something that happens frequently, or is
We'll send the note over there. The wound has nothing to do with your blood counts, other than if you're bleeding, that's dropping your blood count some too. So if they need to fix the wound, then they can go and fix the wound.
well, they've been trying to. They got, they got the wound vacs and got them on both feet now, and
Yeah.
so that's kind of a hassle. I'm just trying to figure out if there's any.
If it's a blood flow problem, if we get you some more blood in there, that may help you heal it up some and make it safer if they need to do any kind of intervention, stents, anything like that. But that's not stuff we do at Carta. It's done by the
Okay,
vascular clinic or the wound clinics, things like that.
Sure.
But we're going to look and make sure we're not missing anything, but I would start these booster shots unless you hear otherwise. It'll probably be next week or so before we get it approved and get all the labs back to verify that's what you need.
so they sent me the card type. Is there anything about the cancer or anything that I'm missing there? I don't really know what all they're looking for. I know that, like you said,
For cancer, your primary doctors will set up a colonoscopy, a prostate screen called a PSA. Have you had a PSA checked and a colonoscopy in the last few years?
yeah.
Okay. So I don't usually redo all those. I'm a blood and cancer specialist. They sent you over for the blood side of things.
Okay, well,
If they saw something on any of those that they're concerned about, they didn't share that with me.
okay, well, that's fine.
But usually blood counts are low for other reasons like kidneys or things. The kidney cancer you had all those years ago, that usually is monitored by your kidney surgeon, the urologist.
I've seen both of those.
When's the last time you had a scan for that?
Probably recently. I've been to the
Okay.
kidney and urologist.
Is that Dr. Cousins, your urology doctor?
Yeah,
At Arkansas
I think he did a
Urology?
scan yeah, I think he did.
Okay.
He couldn't do an MRI because
Okay.
I have a pacemaker. So.
Yeah. So as long as he's happy with things, I'm happy with things. I would do whatever he's telling. Usually once a year scan for about 5 years, and they stop doing scans.
Okay.
But I'm okay with that. If he sees something concerning, then have him send me the results and we'll take a look at it.
Okay.
Okay. But they sent you for the blood side of things, not necessarily for a cancer problem.
Okay. Well,